Coming to the next question, 0.5 ppm fluoride, how much would be the dose in the 4-year-old child? So remember this table. So here in the question, the dose for 4-year child and fluoride mentioned is 0.5 ppm. So for a 4-year child with 0.5 ppm fluoride concentration, according to the American Academy of Pediatrics, the dose of the 4-year child with 0.5 ppm concentration, the answer would be 0.5. So that is why your answer here is 0.5. Coming to the next question, in a poorly controlled diabetic patient, multiple drainage sinuses and woody sinus discharge is seen after the extraction of lower molar tooth. So the diagnosis here is actinomycosis. So in this figure you can clearly see these multiple drainage sinuses that are seen after the extraction of the lower molars. So remember, actinomycosis infection can the most common area is the cervicofacial area. So in this case, the extraction of the lower molar tooth has likely provided an entry point for the infection. So remember, actinomycosis, it is known for causing purulent abscess. Along with you will see the sinus tract formation. So the presence of multiple drainage sinuses and woody sinuses discharge, it is consistent with this characteristic feature. Apart from that, on microscopic examination you would see purulent discharge in the actinomycosis that would reveal the presence of the sulfur granules, so that have a characteristic appearance on hematoxylin eosin stain, showing eosinophilic branching network at the periphery with the collection of basophilic actinomycotic organisms at the center. So the treatment that is, you should know the treatment part. The treatment we consider is the penicillin. It is the standard treatment for actinomycosis. Intravenous penicillin G, it is also given along with the several months of the oral penicillin B. That is the antibiotic treatment that is effective against the actinomycosis Israeli. Now for exam point of view, you should know the culture characteristic appearance. Like the golden yellow colonies, they are seen in coagulase positive staphylococcus. White colonies or oil paint appearance, it is seen in coagulase negative staphylococci. Remember all these. The cetylism, it is seen in H. influenzae. The fish rail tech appearance, it is seen in Haemophilia ducrei. The spidery colonies, molar tooth or sunray appearance, it is seen in actinomycosis. The fried egg colonies seen in Mycoplasma, Drottman colonies seen in Pneumococcus. So remember these for your exam point of view. Coming to the next question, identify the type of wax that is used to make impression for the tropical climate. So the answer here is a type 3. Well, remember type 1, it is used for building veneers. It is soft wax. Type 2, remember, it is used for normal climate, and it is medium wax. The type 3 it is used for tropical climate and is answer of choice, and it is also known as hard wax. So in the tropical climate where the temperature can affect the stability of dental waxes, the use of a harder wax like type 3 it is recommended. So few keynotes that you have to remember for your exam point of view. Most preferred type of dental floss, it's the unwaxed thin floss. The wax coating that is present on dental floss is permaceti wax. Boxing wax is also known as carding wax. Function of carnauba wax that decreases flow at the room temperature. Remember that for your entrance exam point of view. Now let us moving to the another question. NASA it is used in noradrenergic and specific serotonin antidepressant. Well, remember that mirtazapine it is a non-adrenergic and specific serotonin antidepressant, that is also non-adrenaline and specific serotonin antidepressant, that is term that is used as so it works by antagonizing the adrenergic alpha 2 autoreceptors and alpha 2 heteroreceptors. Additionally, it blocks 5-HT2 and 5-HT3 receptors. So the dual mode of action contributes to the antidepressant effect. So mirtazapine it has a unique dual mode of action. So it acts as a both noradrenergic and specific serotonin antidepressant. So by blocking the alpha 2 adrenal receptors, mirtazapine it increases the release of noradrenaline, norepinephrine in the synaptic cleft. So this enhancement of adrenergic effect it contributes to the antidepressant effect. Second, it also blocks the 5-HT2 and 5-HT3 receptors. So it enhances the serotonergic transmission that is associated with the mood stabilization and antidepressant effect. So remember, it is prescribed in treatment of major depressive disorders and other mood disorders. Other option, fluoxetine. Remember, fluoxetine it is a selective serotonin reuptake inhibitor. It primarily inhibits the reuptake of serotonin, leading to increased serotonin in the synaptic cleft. Paroxetine it is also a SSRI. Sertraline it is another SSRI like fluoxetine and paroxetine. Its primary mechanism of action involves the selective inhibition of the serotonin reuptake. So your answer is A. Coming to the next procedure, the procedure that allows a patient to absorb one or more individual who demonstrate appropriate behavior in particular situation, it is known as modeling. So modeling, remember, it is a procedure that allows a patient to absorb one or more individual who demonstrate a positive behavior in certain condition. So the patient observes the individual exhibiting positive behavior. So patient is then more likely to imitate or replicate these behavior when placed in the similar situation. So what are the form of modeling? They can be in live modeling, live models, like individuals like sibling parents who demonstrate the desired behavior in person, or they can be filmed model, behavior if demonstrated through recorded videos or films, or they can be in form of postures or audio visual aids. So remember, the modeling, it has been effective in improving the behavior of an apprehensive children who have no previous dental experience. So imagine a child who is apprehensive about visiting the dentist for first time. So what a dentist can utilize the modeling to ease the child fear and demonstrate a positive behavior that is associated with the dental visit. So in the film modeling, the dentist have a video presentation showing children of similar age happily undergoing a dental examination. The child can watch the film model and show a calm behavior during the dental visit. So similarly, postures, audio visual aids are other mean of the modeling. Coming to the next question, which of following legend does the figure represents? So this one is an example of Osler nodes or Geneve spots. So remember, these are the small erythematous non-tender areas that are associated. So these are, remember, non-tender areas, and they are seen on palm and soles. So they are, remember, they are associated with infective endocarditis. The Geneve lesions, they are different from the Osler nodes, which are tender nodules found on the pads of finger and toes. What are the Roth spots? They are the, remember, they are the retinal hemorrhages with the central clearing. So remember, Geneve spots, they are often painless and may be flat or slightly raised. So these lesions result from small hemorrhages within the dermal blood vessels. So these lesions, they are more commonly seen in conditions like infective endocarditis, where bacteria in the bloodstream can lodge into small vessels and cause localized damage. The protein A in Staphylococcus, it is related to passive agglutination. Well, protein A, remember, protein A, it in the Staphylococcus aureus, protein A is a surface protein that is found in the cell wall of Staphylococcus aureus. So now what is the function of protein A? It has high affinity for the Fc portion of the immunoglobulin. So this binding occur at the crystalline, that is the Fc region of the Ig antibodies. So in the latex agglutination test, the latex bead, they are coated with the protein A. So when mixed with the sample, containing antibodies. The antibody bind to the protein A on the latex beads, causing clumping or agglutination. So the latex agglutination test, they are rapidly used for detection of antibodies. So in the case of Staphylococcus, the presence of protein A allow for the latex particles to agglutinate when mixed with sample containing antibodies specific to Staphylococcus aureus. Next question, the IgG immunofluorescence in relation with immunology, it suggests the pemphigus vulgaris. Pemphigus vulgaris, we know it's an autoimmune blistering disease that affects the skin and the mucous membrane. So in the pemphigus vulgaris, the IgG antibodies target desmoglein, that a protein that is a protein that helps cells to adhere to each other in the epidermis. So the binding of IgG antibodies to desmoglein leads to the loss of cell adhesion, that is known as acantholysis, that results in epidermal blisters. So immunofluorescence microscopy, it is a diagnostic technique that confirms the presence of IgG autoantibodies in the intercellular space of the epidermis. Now immunofluorescence, it can be either direct or the indirect. In the direct immunofluorescence, it shows a pattern known as fishnet or fishnet appearance. The predominant immunoglobulin that is detected is IgG, whereas the indirect immunofluorescence, it is a test that will detect the circulating antibodies in the patient serum. Coming to the next question, so these, remember the key points. Zang cells seen in pemphigus vulgaris, it is characterized by acantholysis. Zang cells show swelling of nucleoli. Remember all these for your entrance exam. Very important one-liners for upcoming exam. In which child pulpectomy is contraindicated? Well, it is contraindicated in leukemia. So these are the contraindication of pulp therapy: teeth with non-restorable crown, excessive internal resorption, or leukemia. The systemic disorders like the leukemia or other type of blood sclerosis, they are definite contraindication to pulp capping and pulpotomy in the pediatric dentistry. Other contraindication could be child with long-term corticosteroid therapy, hepatitis, etc. So these are the key notes for your exam point of view. Remember them. The previous MCQ asked related with the pulpectomy or pulpectomy. Coming to the next question, a carpenter cuts his finger. He comes to emergency room. He is given adrenaline he is giving lignocaine without adrenaline while dressing. So why is lignocaine given without adrenaline? We know lignocaine, it is a local anesthetic that is present for the pain relief during minor surgical procedure. So when lignocaine, it is combined with adrenaline, the vasoconstrictive property of adrenaline helps to prolong the duration of the anesthetic effect. By reducing the blood flow at the site of injury. So while lignocaine with adrenaline, it is commonly used Injecting it into the digits like the fingers can lead to vasoconstriction. So that would result in a reduced perfusion and cause gangrenous necrosis of the digit. So in this scenario, the carpenter cutting his finger, the lignocaine without adrenaline may be preferred to avoid the risk of compromising blood supply to the injured digit. So the absence of adrenaline reduces its vasoconstrictive effect, minimizing the potential for ischemic complication. So especially in the smaller vessels like those that are seen in the digit. So remember, lignocaine without adrenaline, it is preferred in situation where vasoconstriction may pose a risk to the blood supply. So your answer here would be B. During the surgery of lower anterior, the mental foramen was cut through and parasympathetic nerve supply is completely cut off during surgery. So what type of injury it would be? The answer is neurotomiasis. So the most severe remembered type of injury is neurotomiasis. It involves the complete loss of the nerve continuity. So this type of damage, it can occur due to factors like displaced fractures or hit by the sharp objects like the knives, etc. So here there is complete disruption of both the nerves and the nerve sheath. The mental foramen was cut through and through during the surgery, leading to complete cut of the mental nerve, potentially the inferior alveolar nerve. That would be considered a case of neurotomiasis. So remember, it involves the complete loss of the nerve continuity. As the injury described here is the mental nerve, it is cut through and through during surgery, resulting in complete cut off mental nerve that will correspond to neurotomiasis. What will you do to treat T1 tumor in cheek less than 2 cm? So for T1 tumor less than 2 cm in cheek, the preferred treatment is surgical excision. So surgery would be the choice. So excisional biopsy, that involves the surgical removal of the entire lesion. It is commonly performed for small localized lesions, especially those that are less than 2 cm in diameter. The surgical excision that allows the complete removal and excised tissue is sent for the histopathological examination to know the nature of lesion and confirm whether it is benign or malignant. Coming to the next question, the element that is added to steel to make its strength better. The answer is the nickel. Well, the addition of nickel to steel enhances its property, that is the mechanical property. So nickel improves the elastic limit, tensile strength, and resistance to impact of the steel. Remember, while the nickel it is added for strength, the chromium is added to steel for property property that is related to tarnish and corrosion. Coming to the next question, the antibiotic which are used for Crohn disease is metronidazole. Metronidazole, that is Flagyl, it is one of the most commonly used antibiotic for treatment of Crohn disease. So other drugs that you can use is mesalamine, sulfasalazine, or intralesional injection of corticosteroids. So these are the drugs that can be antibiotic drugs that can be used. A patient present with renal failure with uremic carditis, which is the first line treatment? The answer would be dialysis. So remember, uremic pericarditis, it is a condition where inflammation of pericardium, that is the sac surrounding the heart, occur due to the elevated level of urea and other toxin in the blood, typically seen in setting of the renal failure. So the preferred and first line treatment for uremic pericarditis is, remember, it's the dialysis. So dialysis, it is a medical procedure that helps you to remove the waste product. So dialysis procedure helps to remove the waste products and excess fluid from the blood when kidney they are unable to perform this function adequately. So by initiating the dialysis, the level of urea and other toxin in the blood can be reduced. So that can lead to resolution of the uremic pericarditis. Increased dose of diuretics like furosemide may be used to manage the fluid overload, but it does not directly address the underlying cause of the uremic pericarditis. Linezolid, it is an antibiotic and it is not the first line treatment for uremic pericarditis. So your answer is dialysis. The structure seen here on this diagram represents, so it is a simple question. This is representing the lamina dura. So this radio opaque lining of the alveolus that lies adjacent to periodontal ligament that represents the alveolar bone proper, it's the lamina dura. What is lamina limitans? It is the inner organic lining of the calcified dentinal tubule walls. Lamina lucida, it is present in basal lamina that is situated just below the epithelial cells. Identify the maxillofacial prosthesis that would fade over time. The answer is a PVC. So remember, polyvinyl chloride, it is a type of plastic that can undergo change over time, leading to issues like hardening, cracking, and color change. So it has been used in past for construction of facial prosthesis, but now it is little used due to the above mentioned problems. The Marine classification of patient recall class A is, the answer is 6 months to 1 year. So remember that class A patient recall is 6 months to 1 year. Class B is 3 to 4 months. And class C is 1 to 3 months. So class B is for 3 to 4 months. Class C is 1 to 3 months. Remember that. Coming to next question, how is calculus in people who are heavy calculus former different from those who are light calcium formers? Answer is less potassium. So in individuals who are heavy calculus former, the composition of early plaque differ from those of non-calculus former. So the composition of early plaque in heavy calculus formers, they include more calcium, 3 times more phosphorus, and less potassium compared to non-calculus former. So that suggests that the phosphorus may be more critical than calcium in plaque mineralization. And the presence of less potassium is associated with individual prone to heavy calculus formation. Coming to the other question, the patient with a history of extraction of impacted mandibular third molar lying close to inferior alveolar nerve develops following lesion as shown in radiograph. So this condition is known as a neuroma. So traumatic neuroma, it is a rare disorder that occurs due to the damage of peripheral nerves that either results from the surgery or accident damage during the procedure, such as the anesthetic administration. So that is characterized by swelling, and you may see functions like numbness and tingling. Coming to the next question, a vegetarian boy has goat milk. He experienced hepatosplenomegaly. He is most probably suffering from, the answer is megaloblastic anemia. Hepatosplenomegaly with profound megaloblastic anemia can be associated with a deficiency in the folate or the megaloblastic anemia. So in the context of vegetarian boy experiencing hepatosplenomegaly after consuming the goat milk, the megaloblastic anemia is likely the consideration. So megaloblastic anemia, it is characterized by presence of large immature red blood cells that are known as a megaloblast. During mastication, there is dysphagia and neck pain. There is difficulty in swallowing. The most common cause is Eagle syndrome. So Eagle syndrome, it is characterized by, remember, in Eagle syndrome you would see elongation of the styloid process, or there would be calcification of the stylohyoid ligament. So with the elongation, the patient would feel the discomfort in throat, pain in ear, upper neck pain, and dysphagia. So dysphagia, neck pain, difficulty in swelling, they are the characteristic feature. So that is why the answer is option A. Trotter syndrome, remember Trotter syndrome, it is clinical triad of unilateral deafness, neuralgia affecting the branches of trigeminal nerve, and there is defective mobility of the soft palate. So it is not associated with the dysphagia during the mastication. Craniosynostosis, it is a congenital skull abnormality in which one or more cranial sutures they fuse prematurely. So that's not the answer. Answer is A. Coming to the next question, the serum lipase, it is associated with pancreatitis. Well, the serum lipase, we know it's enzyme that play a role in digestion of the fats. So it is produced by various tissue in the body, but more significant source is the pancreas. So during the inflammation or injury to pancreas, such as in case of pancreatitis, the integrity of pancreatic cells, they are compromised. As a result, the enzymes that are normally contained within the pancreatic cells, that includes lipase, are relieved into the bloodstream. So elevated level of the serum lipase in the blood would serve as a diagnostic marker for pancreatitis. The serum acid phosphatase, it is associated with prostate cancer. The serum acid phosphatase, it is enzyme that hydrolyzes the organic phosphates under the acidic condition. So it is a lysosomal enzyme found in the various tissue. So in prostate cancer, there is elevation in the serum acid phosphatase level. Remember, the prostate specific antigen, it is another marker that is used with the acid phosphatase for detection and monitoring of the prostate cancer. So acid phosphatase level can be elevated in other conditions like benign prostatic hyperplasia, prostatitis, and certain bone disorder. Lesion on the posterior slope of hard pellet shows perineural invasion and infiltration. Histologically, spindle cells are seen. Most common diagnosis is the polymorphous low-grade adenocarcinoma. So it is a slow-growing malignant tumor that arises from the minor salivary glands. The histological features that you see is like the spindle cell shaped cells, perineural invasion, infiltration. They are seen with the polymorphous low-grade adenocarcinoma. So remember, it is known for its histological diversity that includes cuboidal to columnar cells with uniform ovoid to spindle shaped nuclei. So the slow growth of this polymorphous low-grade adenocarcinoma and its tendency for the perineural invasion can contribute its infiltrative nature. Coming to the next question, increased airway resistance, it is seen in asthma. Asthma, we know it's a chronic inflammatory disease of the airway that is characterized by bronchospasm, mucus plugging, and edema in the peripheral airways. So that would cause increased airway resistance and obstruction. So in asthma, various factors, what are the factors? Like allergens, irritants, and exercise, they will trigger the bronchial smooth muscle contraction. So these trigger would result in a bronchoconstriction, and hence there would be increased airway resistance. So the increased airway resistance in asthma that would contribute to symptoms. So patient would experience symptoms like wheezing, coughing, shortness of breath.